Hafaday, welcome everybody. Please welcome the Honorable Lourdes A. Leon Guerrero, Magahagan Guahan, Governor of Guam, as well as the Honorable Joshua F. Tenorio, Secundan Magalahan Guahan, Lieutenant Governor of Guam, Art San Agustin, Acting Director of Public Health and Social Services, and Dr. Jana Manglutnia with the Physicians Advisory Group, as well as the Medical Director for Public Health and Social Services. And we'll begin with some opening remarks from Governor Leon Guerrero.
Thank you, Janella. Hafaday, this week alone, we confirmed over 52 cases of COVID-19. Based on the data, most of our new cases are below the age of 50, 18 of them in their 20s. While our positivity rate still remains below 2%, we are acting now to prevent a healthcare crisis before it begins. Until there is a COVID-19 vaccine, there is no silver bullet solution, only hard choices. And because of this increase in cases, I have had to make some very hard decisions. Effective 6 p.m. tomorrow, August 8, we will be effectuating the following restrictions. Social gatherings outdoors or in private accommodations will decrease from 50 to 25. Funerals will be limited to 10 people and only immediate family for viewing. Wakes will no longer be allowed in private homes. From these recent cases, many of these contacts have been traced to funeral gatherings. Public Health will issue further guidelines regarding these restrictions. Furthermore, bars will be closed for the next 2 weeks. Based on information received by Public Health and our contact tracing teams, bars congregate more broadly and in general have not exercised the same degree of compliance across the board. I have ordered a review of the current guidelines for bars and taverns and have asked public health officials to work with industry leaders to develop an effective plan. While dine-in restaurants will still be allowed, we are closely monitoring the situation, and I ask all resident owners and patrons to not let your guard down. As a patron, wear your mask as much as possible. Restaurants across our islands have been acting very conscientiously. Tables are separated, and many have installed plexiglass dividers. As you have read, many restaurants have voluntarily disclosed their contact with COVID-19 and have aggressively imposed sanitation and testing measures. Certainly very responsible corporate citizens. While these restrictions are in place, I want you to know that we are also increasing our efforts. We have enhanced contact tracing and are adding 30 people for tracing and surveillance. Our testing capacity is also increasing to ensure people are traced and tested quickly and efficiently. Announcements of future community testing outreaches will be made once confirmed. Public Health will be enhancing compliance and enforcement of the minimum requirements for business operations and the wearing of face masks and social distancing. Businesses that are not compliant may be closed. I want to thank the people and businesses of Guam that are adhering to all the public health requirements and continue to remain cautious and careful. You are why we have managed to contain the spread of COVID-19 better than many places in the world. As we implement these measures, we need to continue doing what we can. Wearing masks and social distancing are still crucial no matter what stage we are in. We need to be mindful of who we come in contact with. Limit your time with those who are not in your household. Even if you are just with friends and families, you still need to wear your face mask. If you don't need to go out, please stay home. We cannot become complacent, and we must adhere to the directives and to the mitigating efforts. Thank you, and Sijus Masin.
Thank you, Governor. And Lieutenant Governor, would you like to make some remarks?
Yes, thank you very much. And I just want to continue to thank the people of Guam for doing their part in containing the spread. Uh, I'll just add that at the homeless shelter, there are currently 81 individuals that are sheltered, including 21 children. Uh, the governor and I will continue our efforts to provide protection and safety for those unsheltered folks on Guam, and we are looking to expand shelter capacity for all those that remain unsheltered on the island. In addition, the governor and I are in close communication with the superintendent of education, who is working in partnership with the Department of Public Health and Social Services to monitor the situation and to provide additional support as decisions continue to be made regarding schools. And I'll just say that given the situation, the governor and I will meet with the superintendent on his team on Monday to determine the safety situation and to further support schools. There is no announcement that we have to make regarding school opening, only that we will continue to work with the superintendent and that the safety of our children and our people are the top concern in any decision that is made.
Thank you, Lieutenant Governor. I know it's been a while since we've had a press conference, but I'd just like to kindly remind everybody as we open up the floor to questions, you do get one question and one follow-up question. So we'll begin with Mariana's Business Journal, Maureen Maritita.
Buenas, everybody. Governor, these groups are what we might call local clusters. So they should not, certainly in the short term, affect any plans for visitor arrivals. Am I correct?
So in regards to visitor arrivals, we are continuing with the same protocols that we are doing, Maureen. These groups or clusters, it's also, I think, a plus that it's clusters and not just random out there in the community, because then we can have better control and better tracking and tracing of these individuals. So what we're seeing in terms of increase in numbers, as you said, right now it doesn't impact or change any of our directions and strategies towards looking at welcoming our visitors. Protocols remain the same because I really believe our protocol is very safe in terms of visitors and community safety.
Okay, thank you, ma'am. Yesterday at the Guam Visitors Bureau General Membership Meeting, Jerry Perez said that, to paraphrase, that the Bureau was in discussion with you about you being part of a delegation that would visit neighboring countries in Asia, most likely starting with Taiwan. Can you update on this, that that is still an item on your agenda?
So it's been in discussions. I'm still reviewing it. It's going to be my decision to be part of it or be part of this group to Taipei is going to be dependent on how our community here is faced with the current challenges of the increase in our positive cases. Additionally, I did put out a memo to curtail traveling of our government employees, and that's something that I would like to comply with. And so there's nothing any final about it. They're still looking at also what route to take because there are no direct flights from here to Taipei. And so I'm in discussions with Nadine and also with GVB about the itinerary, the agenda, and who we're going to meet with.
All right, thank you, ma'am.
Yeah, and you know, Maureen, the Lieutenant Governor just reminded me, we don't even know if these countries are going to allow us, and we don't even know whether we have to quarantine. So there's still a lot of I think, uncertainties that we need to iron out.
Thank you both.
Thank you, Maureen. Next is Hit Radio 100, Nick Delgado.
Happy Governor, happy Lieutenant Governor, and everyone else there. So, first question: considering where we are today, and we saw just 14 new cases just this afternoon, what do you feel we should have done more of or done sooner?
Nick, as you know, and then as you've been always part of this media press conferences, you've been in the historical experiences of what we have been going through and all the things that we have made. And I have to say that with guidance from public health, with guidance from the physicians advisory group, and with looking at science and data and looking at what other people are doing, what we have done is amazing. I just have to say it's actually much more progressive than any other states and any other countries, in that we acted fast, we instituted our directives, and most of all, our community have been very compliant and very supportive and very, I guess, following the mitigation efforts that we are doing. And so what we're seeing also is the result of being able to test more people. And we have always said that once we start testing more people, we will see and catch more positives, which is what we want to do. It's what we exactly want to do, so we can redirect our mitigation efforts so that we can prevent more increases in exposure and also in infection and so forth. So I think we have done a lot. We've done, I'm not going to say we've done everything, because I'm pretty sure there's always something that we can do. But all the protocols that we put in place, all the policies that we have put in place, all the programs that we have put in place is working. How do I know that? Because we're catching a lot of positives, for example, from the quarantine. And we're also monitoring out there and testing. And so we're catching also asymptomatic positive test individuals, which is what we want to do. And so what we're doing right now is exactly what any prudent government would do in protecting the safety and health of our people. And it's exactly the right course, where we are looking at where are the links, what can we do to mitigate more efforts into the links of these contact tracing. So what could we have done better? I don't know. What do you call that? Discover vaccine.
Yeah, I was hoping to hear.
Nick, I just wanted to add that I think right now we've been seeing good numbers, generally speaking, and up until this week, most of the cases are coming in from quarantine. I think it has made everybody feel a bit more lax, but that is a false sense of security because we have active cases on this island. And so I would just ask everybody, all of us individually and collectively, to reconsider what we do and really try and prevent the spread by really be safe in all our interactions, including within our families. I think that's something that I would like the people of Guam to do. That's something the governor spent a lot of time talking about months ago. It's something that we need to return to. And Dr. Manglonia has something.
Can you hear? Okay. I would just like to say that in any pandemic, there are things the government can do, and there are things the community can do. And I think to that end, despite everything that we've done, it turns out at the end of the day that the front line, the community, is the one that controls this. In all of our contact tracing, we have had little to no transmission when people wore their masks and socially distanced. And so I think we have to get that message out. I look at you and say, what can you do? And what you can do is follow the directives, because largely all the cases we've had, be it congregate settings, be it travelers, be it anywhere, is breaches in what we've proposed. and that is social distancing, wearing masks, washing your hands. And I think the numbers would be a lot less. So the government is doing all they can do, and we continue to look for other avenues to mitigate this. But the most obvious wild card is the community. And we implore you to please join hands and help us with this.
9 months since the start of all this, and it's still not a time to let our guards down for sure. Art, did you want to chime in?
Hold on, Nick. The Director of Public Health also would like to make some comments.
Thank you.
Thank you. Thank you so much. With all the comments made by the governor, lieutenant governor, and Dr. Manglonia, I do want to add on that although we have been sending those messages, and I completely agree, there is a degree of social responsibility and personal responsibility that we as a community need to step up to. But we also want to share with the community that although we are scheduling our community testing, our Northern Community Health Center is open for appointments for free COVID-19 testing from 9 to 12. We're also building in-house capacity. By the end of this week, today, we have 30 additional contact tracers, 29 who have completed the online course from the Association of State and Territorial Health Officers, and one went through the Johns Hopkins. The direction of the department is to build in-house capacity. And so with that said, what's going to happen is these 30 online trained contact tracers, which is an acceptable means to be trained, will then start shadowing with the ongoing contact tracers. Today, we also have 12 investigators / contact tracers, and we're at 6. So we still have capacity in-house. I want to assure the community that there is no surge within the department. We are looking at where there may be potential needs to increase capacity, and we're doing just that. As the Lieutenant Governor has said earlier, we are also partnering with the Department of Education Superintendent. We have follow-up meetings with him. We're looking at his plan. We're also working with Mr. Juan Flores from the private school. And so we're really partnering with as many people as we can to be prepared and to posture and poise ourselves so that we are positioned to respond. In terms of what we're all doing, we're doing the best we can as public health and social services. We are getting an insurmountable amount of support from the governor and the lieutenant governor, this administration, and many other folks that are joining us. And we are going to resume community testing. We are looking at how we can do that within our own resources and also looking to build partnerships. So we're definitely have many things and tasks ahead of us, but we're very much forward thinking, and we want to do what we can to assure the community that our department is doing everything we can to protect and safeguard our health with regards to COVID-19.
Thank you all for your responses. For my follow-up question, Governor, you've said that you're looking at other ways to generate revenue as the tourism industry has been hurting. What other industries have we tapped into so far? And if none yet, what's the delay?
So as I've always said before, Nick, our economy is being stood up by, of course, tourism. It's being stood up by military spending. It's been stood up by local and federal government spending, and those other entities have actually helped us, just not during this pandemic, but throughout our history as a government. And so when I look at our revenues and I look at our economy, those entities, without the tourism during pandemic, has given us the stability in terms of our revenues and also in terms of our economy. Other industries that, since we've started our administration, that I'm really aggressively pursuing is, of course, agriculture and also aquaculture. And if you see, you'll start seeing farmers coming more up to the forefront in terms of producing products and in terms of providing produce to our community. And you'll see more of that. There's a really very aggressive plan to, again, support that with our resources and make that a stronger agricultural industry in our community. And I also want to say, though, Nick, that we never closed during this whole pandemic. We never closed construction industry. We continued on with construction. That's another source of jobs and another source of revenues. We also did not close a lot of the retail businesses. For example, we continued on with the mom and pop stores. We continued on with the grocery stores. We continued on with the hardware stores. We continued on with the medical supplies. We continued on with the clinics. And so we never really closed our economy. And again, remind the public and remind the media that tourism itself closed. As I have said, I've been tracking this coronavirus since December, and I could see the tourist numbers going down every month. And that's because at that time, China was starting to see coronavirus. South Korea was starting to see the coronavirus. Japan was starting to see the coronavirus, and they were the ones not decreasing their travel to Guam. So again, I want to say tourism never ended. Tourism never stopped. We were welcoming travelers from every part of the world, the nation, and also in Asia. What we did do is we made sure we put in directives and mitigation efforts to protect the safety of our people here. So, and as you know, I have no control over the borders, but I do have control on entry and what we need to do as after they enter our island.
Yeah. And then real quick, Gov, I know that my time is up, but I just wanted to clarify. So the public health emergency that's been extended now.
Sorry, Nick, we can't hear you. Can you speak up? We lost you. Your volume is off. Nick, are you there? We can hear you talking, but we can see you talking, but we can't hear you. Oh, here, he typed his question. He's asking if the public health emergency has been extended. Public health emergency.
The public health emergency is targeted to expire on August 29th, and I have every intention to extend it.
Thank you, Nick. Next is PNC, Jerry Partito.
Yes, good afternoon, everyone. Governor, as you know, testing is the key to this COVID-19 crisis, right? There have been national reports that a shortage of test kits is looming because of the spike in the US and the high demand for that. My question is, how is our stockpile of test kits? And do we have enough for all the testing that's needed? What is the what percentage of the population has been tested already? And what is your administration's target percentage to test in the testing of the population?
Okay, so I'll comment and then I'll have the director give you more details. So our testing capacity, according to public health, is good. And we are targeted to receive test kits every week or every 2 weeks. We have tested our community. Our penetration percentage in testing a community is 14.4 so far. And that's pretty good. We're way ahead in most of the states in the United States. So a penetration of 14.4, that's like close to 15%, is, I think, something that is good for us. But we will continue to test. We cannot test 100%, but we will continue to test as much of our community, which I have said we were going to do, and we are doing. And then the testing capacity is good. So I'll just have the director, Art San Augustine, give you more details about the testing capacity.
So with regards to our testing capacity, with regards to our latest data of August 6th, we have 12,297 kits remaining. Every 2 weeks, we receive 2,500 test kits. In addition, we are working with several clinics and we're building their capacity so that they would also receive the Abbott ID Now machines. And by doing so, we're also providing them the kits, the test kits. And what that does, it gives people here on Guam who are returning travelers options in terms of where they can go to go through the test for COVID-19. So in terms of our current supply, we seem quite in a good standing. We're in good standing at this time.
Okay, thank you. And my last question is for the governor. Governor, Hawaii was recently included in Japan's list of safe international destinations, right? So are we working to get the same status for Guam?
Absolutely, we are working, but I think right now Japan isn't really very interested in traveling. As you know, their increases in positive cases are doubling. And of course, if you're tracking Honolulu, Honolulu has tripled its positive cases. And they're also thinking about lockdown. So I think at this point in time, that is not their priority. But we are working with Japan, and we are working with our Japan market agents, and we are also working with the government there to have a international travel relationship with us. However, they also require quarantine of their returning residents, and that's a deterrent for traveling. And I think until such time that they lift that, international travel wouldn't be as, I think, as frequent and as robust as we would like it to be. But we want to express to Japan that we are a safe community for travel and for experience with their residents.
Okay,
Thank you, Jerry. Next is KOAM, Nestor Lecanto.
Hi, good afternoon, everyone. Good afternoon, Governor. Governor, you made a point in your opening remarks pointing out that the majority of the 52 cases this week were people under 50 and that at least 18 of them were in their 20s. Was there more to that message that you wanted to elaborate on?
Definitely, I want to make sure the young generation who are maybe a little bit lax about following and maybe thinking that they would never get COVID-19 virus, want you to know that even at the hospital, we are experiencing younger cases now. And more serious cases to the point of, ICU and ventilation. So I just want to say that this virus does not discriminate, and this virus doesn't discriminate against age, gender, race. It is a very serious, very contagious virus, and I want the younger generation people to really take it very seriously. And not think that just because they're young that they won't get this spread, or they won't get this infection and they won't get sick. Of course, numbers say that the most vulnerable population is your older population with comorbidities, but that doesn't, I think, excuse any of the younger generation to not be very serious about protecting themselves, protecting their families, protecting their friends, and protecting the community as a whole.
So having said that about the young people, do you think schools then should not reopen in about 10 days from now?
As the Lieutenant Governor said, we're working very closely with the superintendent, and the Lieutenant Governor can add to this. Definitely, Nestor, we are going to make sure that when the schools open, that the schools open and they're ready, and that their actions and their protocols and whatever they have put in place to protect the children is going to be a success. And so we want to make sure all of that in details. And as Art said, he has been working very closely and partnering very closely with the Department of Education. And really, that is in conjunction with the superintendent, and we are working on his recommendation. But of course, if we feel, or if I feel that maybe a delay might be in the works, we will certainly relay that to the superintendent. But as of now, we are following the superintendent's recommendation and his plan.
I just wanted to add that the critical component here is that parents have a choice. And in some of the jurisdictions where you see some lawsuits looming, they made decisions that forced the schools to open with face-to-face instruction. Here, from the get-go, the option is to give parents an opportunity to have online learning for their children, and for the decision-making to be part of that based on the situation of their individual households and their capacity to of their children. But I just wanted to say that the second point, and I said this in the beginning, we are looking, we followed the lead of the superintendent of education, but I guess as Ronald Reagan says, trust but verify. Our verification will be based on how public health and DOE demonstrate to us all the different ways that we can maintain the safety and security of our students. And so I was just tell you that we'll have an opportunity to immerse ourselves with all the plans that are in the works and the additional plans that are in the works or being worked on right now. And I would just say continue to this is an evolving situation, and we will certainly keep everybody informed. I think it's going to be very critical that public health and DOE are able to give the assurances to the parents that select to have their children come to face-to-face instruction, that all of the measures that we can possibly have, we are doing. And that includes the transportation of children on school buses. That includes the public health response if and when a case does occur. Hopefully it won't, but based on the situation we see elsewhere, we cannot rule that possibility. And I would say that the planning would be based on assuming that that will happen. And again, safety of the kids is the #1 priority. And as the governor said, she's authorized the different schools to open based on plans. We will now see whether or not those plans are up to the standard that the governor believes there should be.
Thank you, Nestor. Next is PDN, Jojo Santo Tomas.
Hafide Gov, Hafide LT, our doctor. Given the recent rise in number of confirmed positive cases, is hiring 30 contact tracers even enough? I know this is not an easy job for them. Is that going to be enough?
In terms of hiring, we're actually not hiring 30 contact tracers. What we've done is we've built in-house capacity. We've identified staff already working with public health and social services. So they've done the online training. They'll now be working with our contact investigators, tracers, to become better familiar with the process so they can also assist, not just with the current cases, but perhaps in future cases. It also allows us to give those that have been working this process since March some time off so they too can rejuvenate and get some rest time, and they can come back and assist. Right now, with the number of cases, we have sufficient staff. However, if we see any indication that we need to build capacity, we will certainly do that as well.
And my follow-up is, could you please repeat the earlier numbers? My audio was sketchy, but the number of people you have doing tracing, what it was prior, what it's been, and what it is now?
Well, right now, in terms of case investigators, we have 6, but we also have additional 6. And in terms of contact tracing, we can reach back and we have an additional 9 to the 6, which will make it 15. We have 4 that are existing in the other divisions of public health and social services. And so these 4 have already been trained. Some have actually helped earlier in the response and have since returned to their respective divisions. Well, all that has happened. We also now have built additional staff capacity of 30. So we have, I would say, roughly over 45 staff within the department who have either actually done contact tracing or have been trained up to do contact tracing.
Thank you, Jojo. Next
Thank
is
you.
I-94, Tomas Manglotnya.
Hi, good afternoon. My first question is for the Lieutenant Governor. I wanted to follow up if the homeless shelter contract at Globo Dorman Mighty was renewed and if any plans are in the works for more shelters to open soon.
Yes, the answer is yes, and this contract will continue to be renewed for the foreseeable future. The commitment that the governor and I have are to provide permanent emergency shelter capacity while we continue to build out options for families and individuals to transition into other types of housing. So yes, it is, along with the service agreement with the Catholic Social Services.
Thank you. And my follow-up question is for the governor, shifting to some news out of the Department of Navy. Governor, as I'm sure you might have seen, the Navy's record of decision released today says that they'll continue on with the Mariana Islands Training and Testing Study Area, implementing the preferred alternative 2, which appears to be an increase in activity in the region. What's your comment on this news?
So we have been in communication with the Navy about the Marianas training. And yes, I am aware that they have signed the record of decision. And I know that they are moving forward to get their permitting through MAP. And but we are also in communication about the consistency of policies in relation to the programmatic agreement. And I know that we are going to be in discussions, even more so, in terms of our concerns about the sonar radar effect on the mammals. That's the one issue that we are discussing with them on how can we be assured that these won't have any impact on our mammals out there. So they are moving forward with the record of decision. They are doing it through, the legal processes that they have. And eventually, I think they will be implementing their training.
Thank you.
We are looking to see on how we can mediate this this issue that we are concerned about, which is inconsistent to our policy.
Thank you, Thomas. Pacific Island Times, Johanna Salinas.
Half a day, everyone. All right. So, my question is, what does the governor think of Senator Luis Muñoz's bill that would set a limit to the scope of emergency directives?
You know, Joanna, I have not seen the bill, so I can't really comment on it.
Okay. So, well then, I guess I'll ask, there is information that based on Advisory Council, Public Health will send a rapid response team to hotspots like businesses and schools. Has that team been set up yet?
What rapid response thingy are you talking about? The director is not aware, so he can comment.
Could you share with me the rapid response team you're speaking of in terms of partnering with DOE, for example? We are in conversation with the superintendent so that we would partner depending on the case, but we still go to the protocol as we would with any disease. We would do contact investigation and contact tracing. So we would definitely be there at the very first opportunity. So in one situation, he may call me at 11 at night, which is all part of the job, which I thoroughly enjoy at this point. I'll let the governor, lieutenant governor, when it becomes overbearing, but it's so enjoyable right now, almost crazy enjoyable. But with regard, though, having said that, we'll work with the protocol process. We have existing protocols. And so this is COVID-19, but we have protocols that we use for TB and we use those same protocols. So I'm not sure if you're saying is there people designated for rapid response? We have people already designated to respond as the situation emerges, be it this COVID-19 or a TB case.
Oh, okay then, all right. So given this spike in numbers, do you think Guam should be reverting back to PCOR 2?
No, I would continue on with the PCOR 2 and we'll look and see what happens. Sorry, PCOR 3. I don't have right now any plans to revert back to PCOR 2, but we are instituting some restrictions to help us again strengthen our preventive measures, and we're being proactive. And I think what the decision that's made is very appropriate and adequate for the situation right now.
Thank you, Johanna.
Okay, thank you.
Next is Guam Daily Post, Heidi Eugenio Gilbert.
Good afternoon, Governor. Good afternoon, Lieutenant Governor, everyone. As we move forward, there's likely going to be more and more people who test positive. Should we be expected to shut down an entire business or an entire government agency every time there's a positive case? There has to be a better way to respond to positive cases. What has been the discussion among your health experts, Governor?
So our response is basically more a targeted approach and a case-by-case approach. And so your comment about we expect to have more and more positive cases, I am hoping that as a result of what we are instituting, that we would not see this great of a positive increase, and that's the goal. That's the success that we're looking at. As far as you said, closing a whole business and closing government down, again, we will have to look at what the situation is and address it according to the situation. And right now, like I said, our situation is very targeted, and we already know where these sources of infection and exposure. And what we're doing is cutting that off so we can prevent any more infection.
Thank you, Governor. Shifting topics here. Can you talk about your fiscal 2021 revised budget? Do you have a more concrete figure today?
Sorry. I do have a very concrete figure. I'm very confident that if we worked from a revenue source of 780 million, that we would be able to provide the services that our people deserve. And we would be able to provide the necessary public safety, the quality of education and healthcare. And so I am working with the Office of Finance and Budget to work from a $781 million revenue, and I'm very confident that we will meet that revenue projection.
Thank you, Heidi. And that concludes our question and answer portion. Governor, would you like to make some closing remarks?
Thank you very much for your questions. And I'd just like to thank the Lieutenant Governor, Dr. Manglonia, and our Director of Public Health, Arts and Augustine, for being part of this press conference, because indeed they have given us good information to the public and very credible information, so that we can assure the public that although we are seeing increase in positives, we are very, again, encouraged and very confident with the measures that we have put in place. And to please make sure that you wear your mask. This is the vaccine of our island right now against COVID-19. Social distance, and also wash your hands. You know the drill. We've been doing this now for 5 months. And also to make sure that you stay home if you do not need to go anywhere that's important, critical, and essential. Again, if we do this, you will see great results in terms of decreasing our exposure and our infection. And just want to also say and thank the Department of Public Health, the National Guard, the Police Department, GMH, GRMC, all of the clinics out there for their support and for this great way of, and very, I think, scientific way, very methodical way of addressing this virus. And also would like again to thank the community for also their support. And I just wanted to say one thing, just to show how good we are. I just met with the new general of the Air Force, General Stone, and also his colonel, Colonel Aragon, who's like the commander. And they have been to places where COVID is very rampant, and they were very impressed by the way of our people wearing their mask and social distancing out there in the public. Colonel Aragon was telling me that, when he went to businesses, that businesses were taking his temperature, doing the sanitation, reminding people to wear their masks, their social distance. So he has a comparison to make. And he was very complimentary and very impressed with the guidelines, protocols, and our community support and our community compliance. And that's like Dr. Manglona said, that's how we're going to win this war. So thank you again, and let's do our part, our very critical part for the love of our family, friends, and our community. Thank you, and Sejus Masi.
Thank you, everyone. Please stay safe.